Knock. My name is Brandy Avery, family nurse practitioner student. Today I will be performing a comprehensive head-to-toe physical assessment. I have washed my hands and gathered the necessary equipment, including my stethoscope, pen light, reflex hammer, tuning fork, snellen card, cotton applicator, tongue blade, and ophthalmoscope. Can you please tell me your full name and date of birth?
Megan Bowerman, 9/20/1988.
I have verified that information. I will be explaining each step as I perform the exam. I am assessing the patient's overall appearance, hygiene, skin color, posture, mobility, mood, affect, and ability to hear and communicate. The patient appears alert and oriented to person, place, time, and situation. Let's go ahead and do your vitals. Do you take any meds?
No.
Okay, blood pressure is 120/70. Oxygen is 97%. Heart rate is 66. Respirations are 18. And go ahead and step up on the scale for me, please. Okay, perfect. And you are 66 inches, which is 5'6". And I have reviewed her BMI as well. I am inspecting the hair for quantity, distribution, texture, and evidence of hair loss. I am inspecting the scalp for any lesions, scaling, dandruff, or infestations by separating her hair. I am inspecting the skull for symmetry, contour, and deformities. I am inspecting the face for symmetry, involuntary movements, lesions, and facial hair distribution. Everything looks normal. Everything is symmetrical. Cranial nerve 7 assessment. Please wrinkle your forehead. Okay. Close your eyes tightly. And smile showing your teeth. Okay. And puff your cheeks out. And stick your tongue out. Okay. Move your tongue from right to left. Good. Facial movements are symmetric. Cranial nerve 5 assessment. Please close your eyes and tell me when you feel me touching your forehead, cheeks, and chin.
No. No. No.
Okay, good. Sensation is intact bilaterally. I am going to palpate the temporal arteries for amplitude and tenderness. Any tenderness? Good. I am going to palpate your skull for any deformities, depressions, tenderness, or any masses. Any tenderness?
No.
I am going to palpate the frontal and maxillary sinuses for any tenderness. Anything?
No.
Okay, good. Next, I will inspect your eyes. I'm going to inspect the external eye structures, including your eyebrows, eyelids, conjunctiva, sclera, cornea, and iris. Visual acuity test will be assessed using a Snellen chart. Please cover your right eye and read the closest line that you can see.
DE FPOTEC.
Okay, you've got 20/20 on that eye. Go ahead and cover your other eye. Read the closest one that you can see.
FELOPZD.
That is 20/25. Good deal. Visual fields by confrontation. Please look directly at my nose and tell me when you see my fingers moving. Visual fields are intact. Corneal light reflex is symmetric. Extraocular movements. Please follow my finger with your eyes only. Extraocular movements are intact. I am going to assess your pupil size and equality. Pupils are equal, round, and reactive to light and measure at 4 millimeters. I am checking accommodation. Please look at a distant object and now focus on my finger. I am performing the ophthalmoscopic examination. I am visualizing the optic disc, retinal vessels, retina, macula, and background. Good. I am next going to inspect your ears for symmetry, alignment, lesions, discharge, and deformities. I am palpating the auricles and mastoid processes for any tenderness. I am palpating lymph nodes of the head and neck. I am inspecting the external auditory canal and tympanic membrane with the otoscope. The canal was clear. I could see the tympanic membrane bilaterally with no cerumen. The tympanic membrane is pearly gray with a visible cone of light. Next, we will do the whisper test. Cover one ear and please repeat the numbers I whisper.
6, 7, 8, 1.
Okay, cover your other ear.
12, 3, 4.
Good. Okay, next I'm going to do the Renai test with the tuning fork. Tell me when you no longer hear the sounds.
Now.
Okay, good.
Now.
Good. Next, tell me if you can hear this in both of your ears. Good. Next, we will move on to the nose. I'm going to inspect the external nose for any symmetry and any lesions. And I'm going to look in your nostrils. Okay, both nares are patent. Please occlude one nostril and breathe through the other nostril. Okay, good. Now go to the other side. Next, I am going to inspect the nasal mucosa and septum using a pen light. Now we are going to move on to the mouth and throat. I am inspecting the lips, buccal mucosa, gums, teeth, tongue, floor of mouth, hard palate, soft palate, and tonsils. Please open your mouth and say ah. Good. The UV lobe rises midline and the soft palate elevates symmetrically. Next, we will move on to the neck. I am inspecting the neck for symmetry, masses, and pulsations. Please swallow for me. Good. I am observing thyroid movement during swallowing. I am inspecting for jugular venous distension. Good. I am auscultating each carotid artery for good. Good. Okay, next. Oh, I'm sorry. I have to have you go ahead and hold your breath for me. Okay, good. Go ahead and breathe. And then hold your breath for me. Good. Next, I'm going to palpate your thyroid gland for size, symmetry, nodules, and tenderness. Okay. I am going to palpate your cervical lymph nodes. Any tenderness?
No.
Good. I am going to palpate the carotid pulses one at a time. Good. The trachea is midline. Please touch your chin to your chest. Good. Look up towards the ceiling and turn your head left to right. Good. Touch each ear towards your shoulder. Good. Range of motion is intact. Next, we will move on to the chest and lungs. I am inspecting the chest configuration, skin, symmetry, and respiratory effort. Thoracic expansion is symmetric. I am palpating tactile frematus. Good. Please say 99 each time I move my hands.
99, 99, 99.
I am palpating for tenderness and masses. I am palpating. I am assessing spinal alignment. And I am percussing the posterior, lateral, and anterior lung fields. Percussion note is resonant throughout. Please take deep breaths through your mouth. Good. All lung fields are clear to auscultation. Breath sounds are clear bilaterally. Egophony assessment. Please say E.
E.
Okay, next we are going to move on to the heart. I'm inspecting the pericardium for lifts, heaves, and visible pulsations. I am assessing the jugular venous pulsations. And I am palpating the pericardium. Good. I am locating the point of maximal impulse. I'm auscultating the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. Good. I'm using the ball over the apex and left sternal border. Heart rate and rhythm are regular. S1 and S2 are present. No murmurs, rubs, or gallops are noted. Now we are going to move on to the upper extremities. I am inspecting symmetry, skin color, lesions, texture, and nails. Good. I am assessing your capillary relief now. It is less than 2 seconds. Radial pulses are 2+ and intact. Your brachial pulses are 2+ and intact. I am assessing skin temperature and turgor. It is warm. It looks good. Please raise your arms. Move your arms forward, backward, and out to the side. Good. Patient has good range of motion in upper extremities. Please bend and straighten your elbows. Rotate your forearms. Move your wrists and fingers. Good. Now push against my hands and pull. Good. Grip my fingers. Good. I'm going to tap your median nerve. Good. Hold your wrists flexed for 60 seconds. 60 seconds are up. Good. Okay, next we are going to move on to the abdomen. I am inspecting contour, symmetry, skin, umbilicus, and pulsations. Go ahead and lay down on your back for me. I'm going to listen to all 4 quadrants. Any issues going to the bathroom?
No.
When was your last bowel movement?
This morning.
I'm auscultating the aorta, renal, iliac, and femoral arteries for Brule. I'm listening for venous hums and friction rubs. I am percussing all abdominal quadrants. Good. I'm listening for, predominant tympany is noted. I am measuring your liver span. I'm assessing for splenic enlargement. I am performing light palpation in all 4 quadrants. Any tenderness? Good. I am performing deep palpation. No tenderness, guarding, rebound, or masses are noted. No distension. I am palpating the liver, the spleen, and the kidneys. Good. I'm assessing McBurney's point. I am assessing CVA tenderness. Go ahead and sit up for me. Good. Okay, I assessed the Rovsing sign, Overturator sign, and Murphy's sign. Next, we will move on to the lower extremities. Go ahead and sit on the edge of the bed for me. Okay, I am inspecting symmetry, skin color, lesions, hair distribution, and varicosities. I'm assessing for arterial insufficiency. I am assessing skin temperature, turgor, and edema. I am palpating the popliteal, posterior tibial, and dorsalis pedis pulses. All are intact and are 2+. There is no edema. Please move your hips, knees, ankles, and feet through range of motion. Okay. Good. Good. Okay. I want you to take your feet and press down, and now pull my hands towards you. Good. Muscular strength 5 out of 5. Next, we will move on to neurological. Position sense. Please close your eyes and tell me if I move your finger up or down.
Up, down, up, down.
Next, take your finger to your nose. Okay, now do it to your left hand. Good. Next, rapid alternating movements. You can just tap each hand. Good. Heel to shin test. If you'll take your right heel, rub your left shin. Now, left heel to the right shin. Good. I'm assessing light touch sensation. Please tell me when you feel the cotton swab. Go ahead and close your eyes.
Yes. 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 Yes.
Okay, good. I'm going to assess sharp sensation. Please tell me if you feel something sharp.
Yes. 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 Yes.
Next, tell me, I'm sorry, deep tendon reflexes. Let me grab my reflex hammer. Okay. I'm going to test your biceps, triceps, patellar, and Achilles. Good. Good. Next, we will move on to the musculoskeletal. I am going to palpate the cervical, thoracic, and lumbar spine. If you could stand up for me, please. Bend over and touch your toes. And, I'm sorry, can you lean backward? And then rotate left and right. Good. Now, then sideways to the left and to the right. Good. Can you walk on your toes? Okay. Can you walk on your heels? Good. Please stand with your feet together and your arms at your side and close your eyes. This is the Romberg's test. We will wait 20 seconds. Romberg's test is negative. Okay, this concludes my comprehensive head to toe assessment. Thank you for participating.